everyone, I'm back here, Face It with Dr. G. I'm so excited to be here to talk with you today, and I have the most special guest, Dr. Jason Emer. We are going to talk all things personal life, professional life, medicine, how he got to his extremely successful practice, skincare company, and everything in between. I cannot wait for this. Welcome.
Thank you for having me. I'm very excited. I've been waiting for this day.
Waiting for this day. Well, here we are, and it's just going to be fantastic. And truly, as physicians at our core, to transition over to entrepreneurship, to being a leader, to having a phenomenal team, to having a skincare company, we have a lot of parallels. And I'm so excited to hear how you did that, because it's a question I get all the time.
Well, that's why I was excited to be on the podcast, because I've seen you really grow a lot over the past few years into more of an entrepreneur rather than a provider. And I always was like that, but I always had issues because of it. And I haven't really told my story. Eventually I feel like I'm going to write a book or have a TV show to go through it. But I think doing the podcast really can show people that doctors, people in the medical professional community can be business entrepreneurs too, and have other things besides just being a doctor as their, in their soul, because I do other things that people don't even know about. But one of the biggest of my sort of careers is my skincare line, which is now launched at, I think we're at like 70 doctor offices in the past 6 months or so. So that's kind of why I was excited to be on here, because I've seen you expand. I've seen, your entrepreneurship, leadership, training, just, giving, providers power and inspo to be able to be themselves, which is what I always was like when I started my career, because you don't even know some of the things I went through as I started about, just so you know, August 14th will be 10 years in Los Angeles, but 16 years in practice. So
wow, congrats.
It's a lot, even though my skin does look beautiful. And
you are so beautiful.
I don't even do Botox yet, but I will. I've definitely had a lot of ups and downs that people don't know about. They only see the successes and what you show, now online and in press and things like that. So I feel like having this podcast was going to be a way for us to kind of just take a step inside.
Yeah, I totally agree. Okay, so bring me back to, and we don't have to go into all the details here, but what made you interested in medicine? I guess Cliff Notes version.
Yeah, I'll give you the real Cliff Notes version was when I was in high school, I was a big athlete. I was actually a college gymnast. A lot of people don't know that. I'm a little stockier now, but I was super skinny when I went to college, about 120, 130 pounds and super hairy. You can see some of the remnants here of the hair removal that I've had done through my residency and fellowship. So I was complete opposite, and I was playing baseball one day, and a baseball smashes. I go down for to catch a ball, and it smashes into my face, and I have to have emergent surgery to fix my nose. And I'll never forget, when I was graduating, there was a picture, you're shaking hands with the person giving you your diploma, and I'm smiling, and my nose is falling all the way down to here. When I look at the picture, and I'm like, something's wrong, after I had this surgery. So it turns out they didn't reconstruct my surgery properly, and I had a damaged septum, and I had, nasal valve collapse. And I was like, I need to be a plastic surgeon, because that's what I want to do. I want to fix noses, right? So I ended up getting my nose fixed actually in college by reaching out to a doctor that I looked up to, not knowing that at the time he was going to be one of the biggest rhinoplasty surgeons in the world. His name's Dean Toriyumi in Chicago. He's written every textbook. If you ask plastics and ENT people, they know everything about him. But I literally sent him an email one day when I was a sophomore in college, and I said, I want to be a plastic surgeon. I have this nose issue. It's always bothered my self-confidence. Can I spend a summer with you? And he said yes. And I wrote articles, and I was in surgery. One of the surgeries I was in for over 10 hours, and I fainted in it because I was so dehydrated and low sugar. And I remember waking up, and he says, thank God you didn't fall on the patient. That's all he said. He's like, good that you fell off the field. And I wrote these articles that ended up getting me into medical school. He also repaired my nose, which I think looks really, really nice for, I had a big Jewish schnoz at the time. which was fixed and it was drooping. So that kind of got me into aesthetics and also just understanding that like certain things affect people emotionally. Now I do acne scars and lasers and all the stuff that we do that, just builds people's self-confidence. But at that time, I thought I wanted to do plastics. And I'm going through my medical school. He gets me into medical school, and I'm doing rotations with him because he's becoming this huge surgeon, my friend at the time. And I do a rotation on ENT, and I remember we were moving a woman's tongue who had tongue cancer, and part of her jaw, and it was just so deforming and all this. But he was an amazing surgeon, all the fellows around him, etc. And he goes, Dr. Emer, go check this woman's cranial nerves when we're doing the rounds. And I go in there, and I check one of the nerves, and she vomits right in my face.
Oh.
Really like Exorcist, okay?
Oh.
I faint, the nurse faints, other fellows faint. It was like, that part of the movie where it just keeps going and going and going onto my face.
Oh my God.
And I get up and I'm like, I can't do plastic surgery. That's what I said. Because you have to go through so many other things that you might not like to actually be a plastic surgeon. And this is in about 2004 to 5. So about 20 years ago. And so I decide, what am I going to do? If I don't do ENT plastics, I thought that's what I was going to do the whole time, was fix people's noses. What can I do? And I just learned about Mohs surgery. I learned that dermatologists were doing surgeries. And I had never even heard about this. So I go to our counselor, and they say, you're not going to get it. You're top of the class, but you'll never become a dermatologist. So think of something else. And you know me now.
It's like, watch me.
Right, I still was the same as you. I'm like, I don't care what you say, I'm gonna do that. Yeah. And so I did this rotation with a very mean person who was a dermatologist in Chicago at the time. I did write an article that got into in New England. I think it was either a New England Journal of Medicine or JAMA or something really big at the time for psoriasis and biologics. And I didn't get in, but I did my internship. And during my internship, and don't worry, I'll get to the points.
I love it.
I get to my internship and I get a phone call. I'm on call. At that time, there's no hours. Rough. I'm literally overnight every Q2. Every other night, I'm staying at the hospital. I get this phone call at 2 a.m, not knowing it's 5 a.m. in New York. Okay, and if you know this person, he'll be up at 4:30. So 5 o'clock is a normal phone call for him. So at 3 o'clock, 2 o'clock, I get this phone call. He's like, it's Mark Lebwall from New York, and I'm calling you because you wrote this article that was on psoriasis, and I want to know if you want an interview for our dermatology program. And I didn't think it was him. I thought it was my friends joking around with me because I'd mentioned his name. And for those that know dermatology, Mark Lebwall is like the biggest dermatologist in biologics and general derm. And so I kind of am like, fuck no, it's not. I mean, I literally say that on the phone to him, and I think it's my friends, and I'm saying this, and he goes, no, this is, and if you aren't going to get here in 24 hours, you're never getting into dermatology. So I literally take my credit card, thousands of dollars later, and asking about 5 residents to be able to cover me for call, and I had to make up about 2 weeks of call. I get there, and they go, we don't know you. You didn't do any research, but write this article. This girl is pregnant and is out of the residency program now for 2 years, so we're opening a spot. We'll give it to you, but you better never let us down. If you don't have a book every time I see you and studying, if I'm here at 5 and you're not here at 4, or if I leave at 6 and you're not leaving at 7, I don't want you in my program. So I get accepted, and I said, you know what, I'm going to be the best. And I'll never forget when I did this program, it was a Clemine Fellowship plus residency, so I was there for 5 years. I remember telling one of the surgeons there that I was going to be the best liposuction doctor in the world, because I found out through many things that liposuction was what dermatologists had invented, and I wanted to learn how to do it. So I learned, and I'll never forget telling one of my attendings that, and she's like, whatever, and I look back now, it's 15 years or whatever, And I'm probably one of the biggest ones in dermatology, at least, and in plastics in terms of body contouring. But then I did Mohs. And so when I did Mohs and I did surgery, we had so many of these Upper East Side women with big scars, flaps, and scars on their face. And everyone would tell you, you know this, wait 6 months, wait a year, and the scar will go away. And all they would give Vaseline and maybe Aquaphor. And I'm like, no, these women are deformed. The guys could get away with it a little bit more, but the women were so self-conscious about it. And I said, we're going to laser these things. We're going to laser them the day after I remove the stitches, a week later, 2 weeks later. And it turns out that some of the research that we did there made a protocol that's kind of standard now in the industry to do lasers, peels, and skincare immediately, or at least 3 weeks after you remove stitches. And so that led me into resurfacing. And then from there, it just progressed. I also did at the time, this is kind of the biggest thing, and then whatever questions you have.
Lots of questions.
Started an HIV clinic. We had an HIV clinic where we were teaching dermatology of HIV. But so many of the patients that I had facial wasting that they didn't have jobs. The stories they would give you about the depression and self-confidence issues, I knew I had to do something. And at that time, the filler companies, it was Bioform Medical, which was Radius. I don't remember who made Sculptra. I think it was Dermic made Sculptra at the time. And then all there was early Juvederm, Restylane, and Evolence, which was collagen. And so I reached out to all these companies. None of them had training programs for residents at the time. So I emailed all of them and I said, if you give me 100 syringes, I will create a program where we treat these patients. And I got my program director to approve it. And they did it. And they started a program. Allergan actually started Rising Star, which is because of me, and it still exists. And people get hundreds of syringes per year in their residency programs to be able to treat patients. So I would hold this monthly clinic with attendings like Heidi Woldorf, that everybody knows who does fillers, and Ellen Marmer, who did it with me, and Huma Khorasani, and all these other doctors. We would do these clinics where we get HIV patients in, plus people that wanted some cosmetics, and we would start treating them. I even went in on extra Saturdays myself and started treating facial wasting. And this whole idea of hyperdilute radius, did that in 2003. The whole, all these things, the neck lines and everything was already doing that. These patients had bone, veins on their whole face. That's all you saw. So we had to do everything you could do to make them look normal. And these stories, I had this husband and wife where it was in an accident in I think late 80s in a car accident, and they got HIV and hepatitis from a blood transfusion. Wow. So, everyone thinks HIV is a, LGBT type of thing, but it's not. There were surgical issues, traumatic issues. There's a reason at that time blood banks were not checking it, and they couldn't get jobs. Literally, they would go somewhere and people thought they were on drugs. We do 2 sessions of hyperdilute radius and panfacial Sculptra, and they get jobs at Starbucks. And they come in crying, telling me their whole life has changed. And I knew fillers could literally be life-changing for people. Yeah. So each of these things that everyone thinks of as now as truly aesthetic, everyone gets it. I didn't do it for that purpose. I did it for life-changing reasons. I had a girl with something called un cul de sabre, where you have a big indentation on your forehead from scleroderma. And I was the first doctor to report using HA filler to fill that line with a cannula from the forehead. This is in 2007, and now we have all these articles and stuff about cannulas and anatomy and ultrasound and all. We were already doing that,
Yeah.
So it's just crazy how it just built up slowly to where we are now. And I think a lot of the people in the industry that are not as much like you or I, who have been in dermatology training and stuff like that, but let's say nursing or PA or NP, where they just go to a couple years, they think this is all normal, but they don't know what we did to actually learn these things and progress and understand. Radius nodules and Sculptra nodules, I was removing them from the face because we didn't know how to mix Sculptra at the time, and little things like that just made me so much of a better surgeon today, that it was all based upon treating somebody's underlying self-confidence, making them look and feel better with your artistry, and the tools that we had at the time, and learning, and it really helped me progress. So what I do now, when you see I do like 5 things at once for an acne scar, or I have a very famous physician right now in the wellness space that is posting me every day for this laser combination we did last week. He did threads, filler, Botox, laser, all in the same day. People think I'm just like a cowboy, but it's not the truth. Like, I did 15 years of learning how to do that and how to help someone heal quickly and properly to be able to get to that position. So in 15 minutes, I incorporated 15 years. But that's kind of...
Wait, I have so many questions for you. I have so many questions.
Right, so
I have
that's
so many questions. I'm like writing notes over here so I don't forget.
But that's where it progressed. But the one thing I want to say is 2 things. One, and then you go to whatever you want, was during the way, I had a lot of doctors that trusted me and believed in me. Heidi Waldorf was one, for example, Ellen Marmer, Mark Lebwell, etc. When in my training, I was asking to do these things that people didn't do, but they believed I could, like eyebrow filler and filling up into the temple for HIV patients, all the way in the back, lifting. This is stuff we talk about now, but we were doing it then. And people were thinking I was out of my mind, but it was the way up, it was how we progressed, it was learning. I remember when I would ask all the nurses, do you want me to lift your brow with a little bit of filler? I could use this thing called a cannula. I couldn't get any nurse to do it. They all thought I was like crazy. Now it's everywhere you talk about. Everyone wants the lifted brow, it's like same thing with jawline for guys. People are like, why are you contouring a jawline? Like, we do folds. Or chin. Like, chin was everything for me, but now it is, but then it wasn't. So it was so much backlash, but I still had those people that believed in me. And one of them, he's passed away at this time, unfortunately, but was a Dr. Norm Goldstein. He was in his 80s during the time that I would come in on Saturdays and do these clinics, and as well as some liposuction. And he developed tattoo removal during World War II for vets in Hawaii, to be able to remove tattoos that they got during the World War. And he had a whole book and everything, he taught me tattoo removal. And he would literally sit in the corner and watch me do these lipo cases, whether or not he was paying attention or not. He signed these forms on his Saturday to let me be who I wanted to be. I would have never been able to develop that confidence and try my skills and build these skills if I didn't have those people. But on the flip side, there were doctors that did not agree. And I would go to conferences and I would get booed. In 2014, I went to a conference, the American Academy of Dermatology, and it was the first year of San Francisco. I was in my fellowship, my second fellowship, and it was the first year we ever discussed PRP in dermatology, being used with microneedling and a laser. And I remember I went on stage and I did a demonstration of Clear and Brilliant, which was brand new, microneedling and PRP, and I said, you do all these together, and this is what people want. You get tightening, you get brightening, recovery, right? I literally got booed. People were like, don't bring this doctor back. I got like a 0 on my evaluation forms because everyone was like, there's no evidence of this. He's performing things that are risky. But what do people do now? All of that, right? So the people that are the ones always progressive and ahead of the time are always the ones that take the criticism, are always the ones that the shoulders are stood on and they have to prevail, because otherwise it's, we don't get progression in the field. And I just kept doing it regardless of what people said.
So incredible. It's so incredible. I have chills.
So that's where we went. And then I moved to Los Angeles and I started my own thing after that.
Yeah. Okay, so I want to go into that too, but I have so many questions and there are so many parallels here. But when you talk about the first thing, this is why I had to write notes. And by the way, have you seen this thing? It's this little dry erase board that lights up, and I'm kind of obsessed with it.
That's so cute.
Yeah, it's amazing. I'll send it to you. So the entitlement aspect of it, right? So there's so many aesthetic providers and everyone offers something unique and different, but people that don't go to medical school don't understand medical school. I don't care what you think. And if you, quote unquote, were going to go to med school, okay. But I appreciate and respect all of the other medical specialties, and so I think we should be appreciated and respected as well. And sometimes I think that's not the case. And I also think that people in aesthetics now are entitled. The fact that you went to someone and said, I will work for you for free for an entire summer. I will do whatever you want. I will wash the floor. I will do whatever just to get my foot in the door, to get the experience. It doesn't exist anymore.
I know. I tell you, sorry to cut you off. I've had
keep going.
fellows, and I actually was going to do an accredited fellowship through both. I've actually been asked by the American Society for Plastic Surgeons as a dermatologist. I was actually offered as the only dermatologist to be a plastic surgery fellowship director, as well as the ASDS. And I said no, because it's too rigid of a criteria. What real life does not incorporate these very rigid learning things. It's on the job, it's trying new things, it's advancements once you've learned, right? So I've had fellows who have come in where I said, I want you to do a fellowship for a year, and I'm going to teach you everything I know with the goal that you will be a disciple to me. You will come in, you will learn everything, be my partner. And within a couple weeks to a month, they're leaving at 5 o'clock. They're not wanting to answer phone calls. I'm 24/7, and I've been in practice 16 years, working almost every single day. If a patient needs me and they call anyone, I'm available at all times. But they're wanting to leave. They're not wanting to. They'll question every single thing that I did and why I do it, and then it's not in the textbook that way. Well, this is real life. Real life is different. How you treat clients is different. The recovery, the follow-up. When someone gets a laser on Friday night, an aggressive one, you need to talk to them the next day. You need to see their pictures or see them. Same thing for surgery. But the people that we have, even in dermatology, going into fellowship, aren't wanting to put that time in and that effort in.
It's wild. This is your given time to make the errors, to do the risky things. You have guidance. You have a mentor, right?
Let me tell you this. So I was one of the doctors doing big lasers when I was in New York. Again, in 2007 to 13, there wasn't a lot of lasers. Fraxel had just come out. There was Cyton erbium. There was a fully ablative CO2, an argon laser, and then some Q-switch tattoos. That's it. There was no microneedling RF. Even therapy was just coming out. It was very new. And maybe there was, some radio frequency on the face, but that's probably it. And so I get a call from the head of Mount Sinai to do his wife's CO2 laser. Right, and I don't. At that time, we don't have skincare products that prep and post-treat and this and that. So if you get hyperpigmentation, you're shit out of luck, and you better get that Triluma or tretinoin and a hydroquinone that's in the worst base possible that irritates everyone's whole face, and use it in hopes that it goes away. Well, that's exactly what happened to me. I did her full face and her eyes, and she comes in like Devil Wears Prada a week later. Fur coat in the winter, throwing it off, hat, eyes coming off, and goes, doesn't it look great? And she's dark all the way around here. I had a heart attack, literally a heart attack. And I was like, it's going to be perfect. And then, start the creams, and a couple weeks later, it looks great. But that's how I learned. I learned by trial and error, development over time, learning what you need to do as time goes on. But nowadays, nobody wants to do that. No one wants
to thinking out. It's this blind faithfulness is what I call it, because it's like, I'm just going to come in and I'm going to listen to what they say and I'm not going to ask any questions. That's how you have to have a certain type of mentality, right? And you're that person that's asking questions, puts themselves at risk for being judged for all of these other people to give their opinions, but you have to ask questions. Why is this not working, right? That's fascinating. Okay, so that brings me to another thing. So you said you had all these incredible mentors, right? And Ellen Marmer, I actually read her biopsies as a dermatopathologist, so I know her well. But, I didn't have a mentor in aesthetics, and I so love that you did. I actually went the ENT route as well, which is very fascinating. You did the same. Kian Karimi was actually a resident when I was at University of Florida. So it's very interesting, but I didn't have a mentor. And so I've had to teach myself everything. I have to teach myself the business side of things, the aesthetic side of things. So it's been really fascinating. So now I feel I give back, and I know you do the same as a mentor. I offer that to people. I offer a mentorship business-wise and medical directorship-wise because I feel it's needed, and I don't want them going somewhere else for that education. So I thought that was fascinating. I love that.
I like that a lot. I've had, some issues with that. I feel like people have come to me a lot wanting to learn, but they don't want to pay or they don't want to spend the time to learn. I feel like what I do, the value of what I do is worth millions and millions of dollars. Besides the cost, it's heartbreak from messing up. It's lawsuits. It's documentation. It's protection. There's other things that I've been through that you can't learn unless you do it, unless you have somebody like me that's protecting you, or like you that's protecting you and teaching you how to not let that happen. I don't think people understand that. They see these courses for $1,000, $1,500 to learn Botox, and they think all they need to do is spend $1,500 to actually learn how to do it, but that's not the case. If you really want somebody to mentor you through a business to make it truly entrepreneurial, successful, there has to be some investment in that. Whether you're giving a percentage of the business or time or a consulting fee or, medical directorship or whatever it is. But I've found that everyone just wants to come in and take my settings and my information and think they can just YouTube it and make it a practice, and that's not the case. My practice is very organized, very structured, like a true business with managers and structure and outlines and everything. And all of that is taught if I were to teach somebody, and I don't think people value that enough.
Yeah. Okay, so let's go to the bit. I totally agree, and it's taken years to get my SOPs of 500 pages or whatever in my team, and it continues to grow, right? So
every day it's changing.
Every single day, the minute you print it, it's outdated, whatever that means.
Crazy.
But for you, so transitioning over, so you moved to LA 10 years ago, did you start your practice right away, or did you join someone else's practice?
No, so actually what I did was I joined Paul Nassif and David Amron. Paul Nassif from Botched, love him actually. But what happened was basically, in a short story is, each of us had our own sort of ideas of where we want to go with the practice. And I think as a dermatologist that does a lot of lasers, people don't understand the expense of that. When you're a plastic surgeon just doing, surgery, there's not a lot of overhead with regards to that besides your staff. But when you're going into derm and you want to do what I did, which was have 1 million devices, you're getting loans, you're getting this, and they never really wanted to provide that to me, even though I was working there and generating revenue, right? So I had to do my own thing. It was the only way. But the problem was I couldn't get loans. So it took a very long time, few years, before I could actually get the loans to really help me progress. And it started with a few devices and some of my lipo equipment, and then as time went on and more, I built it up to more. Now we have over 100 devices in 2 locations, and then we rent a 3rd location in Miami. But eventually my goal is to partner with practices or purchase practices and then teach them the stuff that I know. Under one entity as a group, and the idea would be all doctors share in the development of those practices. But we're working on that now. But my goal is that. So I was with them originally, and we did really well. And I think there's also it's very difficult in this industry. Not for me. I never actually wanted to be famous, and I actually hate doing social media. I do it just because I like to showcase what I do, and I'm very proud of everything I've accomplished, but having to do it every day gets tiring, and it's not something I want to do every day, but I do because it's the only way people can see you. Content is the key, and you have to be posting it consistently. So because of that, I think a lot of doctors, it's hard for them to have partnerships, and because one gets jealous of the other or gets upset if they're bringing in. That happened with the doctors that I worked with. I was getting calls upon calls and they weren't, and sometimes even they would say, oh, he's not free, even though when I was, to steal clients from me and stuff like that. And that's a problem. That's a problem. My goal now is not to give it to others. Is the people that are with me, make them more successful. Like I have a new young surgeon that just came out of New York. He's doing a rhinoplasty today, just started a few weeks ago. Where did he get that case? One of my clients.
That's exactly what I do. We're the same.
I want him to be happy. I want him to do cases. I want him to be able to do more than me. Same thing with one of our New York surgeons, Dr. Rojas. Like he's very good at surgery, but I taught him a lot for males. He did not know how to do that, and now he's getting clients for that. So the goal is to share, and to be partners and learn how to partner. When one of my surgeons does a facelift, I do the laser, or my PAs or my RNs do because I train them, so that you can get a better result. Because some surgeons are just not trained on how to do resurfacing. They're not,
Yeah, and that's okay. We're not trained on everything.
Right, and I don't want to
be
do the
okay
stuff
admitting
that I don't know how to do. That's why with body contouring, I can create the shapes and I can do all this stuff that you guys see with the gladiators and the supermodels, but the tummy tucks and the lifts, I can't do that. Implants, I don't do that. So I have a team, we do that together. And that's how we share. Plus, it's better because one surgeon going for that long, you're going to get tired. It's not going to be perfect. It's better to have somebody that's strong and then tap in the next surgeon that's fresh and ready to go for the next part of the surgery so that they get the best results.
Totally. Do you, you obviously don't operate every day. You're not operating now. Maybe
No,
you
I
already
only
did
do
today.
2 to 3 days a week. And I also now, after the past 2 years, I take off 1 day a week. I work between 4 and 5 days, but we travel every 2 weeks and I work like 10 days straight when we're in New York. And then when I go to Miami, we work straight too. So it makes up for it, but I take 1 day a week where I do other businesses. Like I actually have a lot of other things.
Yeah, we have to talk about those too. But I know that congrats on getting engaged recently. This was
Thank
the
you.
first vacation you've had in like so many years.
Well, that vacation was in 2 years. The one before that was 8 years.
Wow.
So that's what I mean about people that come in and want an exorbitant amount of money to start, or not. Like I laughed at even my new surgeon. I was like, when I moved to LA, I had no income. Like Paul and David didn't pay me to be there. They were like, you get what you bring. So you get a percentage and that's it. There's nothing. And I just was like, okay. And I lived on literally a mattress on the floor having no money for 5 years. And I built my career by bringing patients in. A lot of the doctors now, they want a huge amount of money. They want 4 weeks off. They want this. I'm like, I will not do that. If you want to be learning from me and having be a part of all of that, you need to come in and work and develop those patients that then will bring you, success.
Yeah, and those people do exist, and when you find them, they're gems because it's very hard to find them. But that's why I love business is all about ups and downs, right? And people are like, oh my gosh, this year's been crazy and it's unpredictable and it's so different than last year. I actually love that. It fuels me because the lowest of lows bring the highest of highs, and I learned the most with those lows. Yeah. But you have to be willing to take those risks, and the majority of people aren't. So, the way you think is so similar.
That's like a relationship, my fiance sent me a thing yesterday, a meme, it's like one of those meme videos or whatever, but it was, I'd be with you if, and it was a video of somebody opening their wallet with nothing in it, when a car that was broken down, a house that the tornado damaged it or whatever. Some people, they want to be with you when you're successful and when everything's great, but then when it's not, they don't want to, and that's not the type of people that you want to be around. There's going to be some times when you're doing great, and there's going to be some times when you're not. I've had situations even legally, and I've even had situations where no matter how good of a job you do, someone's not happy or something occurs. Like, I'll give you an example. We do so many revision cases, and I feel very honored and blessed that I actually am this knowledgeable about procedures, from just starting with, these little procedures at Mount Sinai 15 years ago to doing like full body contouring that literally nobody does. Even plastic surgeons will come to me and like, how do you do that? And it's just an artistry and a skill thing for me. But we have patients that are so botched where I know if we go in there and try and fix it, there will be a complication. It's going to happen. And I tell them, I say, look, I can make you improve. Like, we had this girl recently where her stomach was so hard and irregular and fibrotic. I mean, she never would take her shirt off. I mean, she refused. That I could make it completely flat, but at the bottom, when we do the tummy tuck, it's gonna necrose. And it'll be a hole probably about that big for about 3 to 6 months, but it will close, and then we can cut that hole out later and make it perfect. And I told her that, and she was totally fine with it. And it's all about that. And you know what? It did have a necrosis because the blood flow.
But you set the expectations for her. You're like, we can make it better, but
but doctors won't take that. A lot of doctors won't take that risk. So what is she doing right now? Everything is perfect except for this little spot. We got a wound vac on there, and in 3 months we're going to cut it out and redo it. And then it's going to be the littlest thing, and in a year she's going to look amazing, and now she can take her shirt off. But that's for the rest of her life, right? So some doctors, they're just not willing to push that limit. So sometimes, even if you say those things, someone could get mad. There's things you could go through that, despite your best intentions, you don't mean to occur, and that's a low that you want those people around you to be there for you, and you're including staff, including the people that are your high-level support that believe in you, and family and stuff like that. But there's a lot of people that don't, and there's we've had times where we've had to let people go because of revenue or because they're not doing their job or whatever it is, or they're supposed to do a certain thing, and then instead they just threaten you, versus understanding that if your job was to increase revenue and it didn't, we can't have you. You can't threaten me now.
These are the expectations, yeah.
Right, and we have it. I mean, I have a great HR director, it's written out, but no matter what, people just say that and do that. So I feel like there's so much more to relationships with patients, with staff, with yourself, that come into being an entrepreneur.
Oh gosh, that's a whole other podcast in itself.
I'm ready. You tell me when.
I know. I mean, it is the whole people situation. I mean, I've learned so much from the people that I've let go, more than the people. I mean, I learn every day from the people I have here. They're phenomenal. But wow, I'm never surprised anymore with what people can do and will do.
Yeah.
And
I grew up in the Midwest. If I had an issue with somebody, I just move on. I'm not the type of person to, I kind of told you what happened with me and my initial partners and stuff, and I say good things about them and I move on. But
yeah, there's no time for that. There's no point.
And you know what? Is money, you can make it. You could be at the lowest low and be super successful the next day. I mean, I'll tell you, one of the businesses I invested in, we'll talk separately, is a car wrap company. I love cars.
Oh.
Everyone knows that. But long story short,
wait, you said something on your story the other day about who did you see, the famous person that you love, that idolized, that you were?
Was in one of my cars, actually. So separately, I want to tell you, most of the stuff I have is actually not from being a doctor. It's from other businesses that I own. So it's funny, people will see me in a Rolls Royce, which I have, that was the car I was in, and they go, oh, he's just a rich doctor. I'm like, doctor didn't get me that Rolls Royce. My other company did. But regardless, so I've loved cars my whole life, and I have a wrap company, and this company is very successful. And but when it was pitched to me, there was a huge amount of risk to that, and everyone said to me, and you know how I am, I'll take the risk. I love it. I'm passionate about it. I'm like, I know the guy that wants to be the owner of it. I'm like, that guy is like me. He will, if he doesn't make money, if he's not successful, if it's not the best, he will never be happy. And I believed in him, and I gave him the money, and now it's millions and millions. It'll probably be honestly worth $1 billion in the future. In the couple years, it's so successful. So, but what I'm saying is, I do that stuff and have some of these nice things, but it has nothing to do with being a doctor. It's because I'm passionate about that other stuff. I'm still so passionate about being a doctor, but I don't do being a doctor for financial reasons. I do it because I love it so much. When someone's getting ready for a wedding and it's the best day of their life, and 6 months before they come to you with a plan to look a certain way, or the person that has their hair in front of their whole face because they're covered in scars and they're looking down at their initial visit, and 6 months later their hair is back, they look like a new person.
Oh, it's gives me goosebumps.
Yeah, it's like that. Or these HIV patients I told you about, which I don't really have anymore, but the people that I have where, now they've lost 40 pounds on Ozempic, or they had a gastric sleeve and their whole face is falling, and we do a lift or we do their filler, and they are totally so happy now. It changes your whole life, And so I tell my fiance and I tell my team, if I don't feel that every day, then I don't want to do this anymore, because I don't want to do it to be worrying about bringing in money or, supporting people. I want to do it because I love it so much. So when there's issues, that's where you hope that people that care about you see that and will be there for you. And that's where my fiance is. My fiance actually works for me, that, but he is so passionate about the job and supports me so much that it allows me to be so much better at what I do. And I'm sure you have the same,
so awesome.
Because there's no way you could have kids and be a mom, entrepreneur, and all that if you didn't have that level of support.
Yeah, you have to, and it has to be unwavering because there are ups and there are downs and there's everything. Yeah, I mean, having 3 kids and multiple companies and traveling and speaking, I mean, it's wild, but I love it, right?
Yeah, and
You know,
that's the
I
thing.
have recently gotten to a point where I feel as though I need to say no more, and that's harder to do and more powerful to do, and I know my worth at this point, and so I've been much more selective, which very
Good.
happy and proud of. Uh, but I do love traveling and speaking and all that to a point. I've gone down a little bit. But so I was going to ask you something else. So let's talk about your skincare company. That's so fantastic and amazing. I need to hear all of the things.
Well,
There we are.
let me show you this right here. This is our emergency kit. Did not look like this when it started, actually.
It's
I have
beautiful.
the renditions of it over time. It's cute. I love it. It's not like the super luxe, but I like it because I feel like everyone needs a
functional.
travel bag.
Yeah.
Everyone wants to put their skincare in something. I wanted something that's also very valuable with really good results. So when we started, I had so many patients that fly into me and do treatments, big lasers, and they have their dermatologist nearby, but they may not trust them as much to do the bigger things. So I have patients where, maybe a little Botox or filler they'll trust, but a resurfacing or more contouring or a bigger procedure, they want to see me a few times a year, and I'll even coordinate with their doctors and stuff. And
Yeah,
so
I
they
love
would
that.
come in and get these big lasers, and I wanted them to maintain the results, like more than just a few products that they're going to go get at Sephora or even at their doctor's office, right? So I created this kit that they would use post-laser, initially just to amplify the results and make their skin look better, regardless of what products they were using. And in the kit, there's this mask. It's called the Illuminating Mask. It's our number one sort of product. It's basically the hero product. I know it looks like just a plain bottle, but this thing is so powerful. It was designed to just boost your skin. I do it every single week as a retinol micropeel. You guys can learn about it at emerskin.com, and I have tons of things to talk about it. But long story short is I discovered that when you place this on the skin after a laser, this rate of healing was significantly more, decreased redness, cooling, everything that you'd want to help a skin heal, even with the strongest resurfacing, even with multiple passes. Like I do some patients where I do fully ablative erbium plus fractional at the same time, like aggressive 3 to 6 weeks of healing. You use this day 0, 3, and 7, and they heal like it's 2 weeks. So we couldn't figure out exactly why, and I still don't understand completely, but the combination of ingredients which are exfoliating and brightening help prevent pigmentation, decrease redness, and there's a 2-week protocol in here that has our non-hydroquinone lightening serum, basically peptides, vitamin C's, and botanicals for pigment, which it works on its own. And hydroquinone can be very irritating, so that's without it. And then a retinol that's also non-irritating. So that's all in the kit. And then all of a sudden I was like, it would just get sold out. Like we'd have thousands of them. I couldn't believe it. Like people were wanting it, and they were buying it just because they wanted that mask every week. I didn't sell it independently, and they wanted the High Spot, which is the vitamin C brightening serum. They liked it so much. So in the second rendition, we created the whole line, which had basically our High Spot as a large size. This is
There you go.
one of our number one sellers, and I think it's very beautiful. We have different SKUs, all of our SKUs. So our new products will be coming out end of the year, and then each quarter after that, we have more in the brightening SKU, which is our gold foil. We have our retinol in large size, which also is in there that everyone loves. That's now going to be in the acne sort of clarifying SKU. So we have 2 other products coming out in that SKU. One of them has a really interesting pepper extract. It's never been used in a skincare product yet. We've been testing it for 2 years. Redness is gone in 13 seconds. It's insane.
Wow.
You apply it, gone. Like it's wild. Wow. And it's so rosacea, post-laser, girls got to get ready for an event. You put the clarifying serum on, not only does it decrease oil and acne, but it gets redness like that. So
you're going to get these exosome people frustrated. Do you use exosomes?
We use both. We use both.
Okay.
One's more ongoing, one's more immediate. You're not unless I don't know if I believe in the topical exosome being as dramatic long term, and then our peptide serum, I actually made this for post-laser healing, but people like it as anti-aging. And I partnered it with Anti-Age because Anti-Age to me is the gold standard in stem cell and polygrowth factors. So I said to Ian, the owner, I was like, look, I want to make something that complements Anti-Age because it's a part of my protocols. I don't want to compete. So I'm going to make a peptide one that enhances the Anti-Age. So everyone that carries my line, I actually tell them, carry Anti-Age because the peptide matches with the serum. So my Refit Face matches with serum. The brightener was complement to my high spot, and the accelerator matches with my Hyla A. And so all of my, now so it's funny, so all of the companies that are the practices that carry it now, they're actually doing so well because they're like literally getting Anti-Age and Emer Skin together and getting these amazing results. And then obviously post laser, we do other exosomes topically and PRP and the other stuff in the protocols. But in terms of skincare, I wanted to make a product line that I made from scratch. This is not white labeled. This is in labs. I created over years. Took me a long time. Thousands of patients treated. If you guys look at Emer Skin and go to the before and after gallery, we have thousands of selfies, just like what was it called? Rodan and Fields did when they first started. Similar type of thing. And the one, I don't know if you've gotten this yet, but I need to send you the line. Vitamin C.
Oh.
This people go crazy over because it's actually an oil that goes on the skin like a serum. So it feels very velvety and very oily, and then all of a sudden it turns matte, and people are shocked by it. It's also non-oxidizable, so it's clear. And it's very rare to be able to get a 20% vitamin C that's clear. We sell out of this so fast. Actually, every account that gets this, they don't use any other after it. So I love, believe me, I love SkinCeuticals and I love them all, but I try to compete and make one that would be a little more gentle because some of them are alcohol based and some of them have a lot of actives that are very, very strong and irritating. This is used immediately after laser. You can even microneedle this into the skin. So all these things I just love doing. Like I go to the labs, I help develop, I have so many ideas. We have a stem cell mist that's coming out. That basically has the anti-age stem cells in it. It's a partnership. We have my clarifying serum. We have a new botanical enhancing serum that amplifies all the other products that you're using in an array of botanicals that are going to be coming out. We have an actual in-office peel that's going to be coming out for pigmentation. It's going to be pretty competitive against some of the lines that are out there. I hope they don't hate me once it comes out. And then
ruffle those feathers. Go for it.
Yeah, listen, I want what's the best for people, and I also want what is different for providers. Because if you're a doctor and every med spa in the area has the same thing, what makes you any different? Like, we want progression, and you want to try new things that are just going to get your patients excited. And my goal is to create something that the people get involved in, create something new and exciting for them. Like one of our accounts is in, I think it's like Utah or Kansas, I can't remember, in a random area. And when she carried this, it amplified her skincare sales because no one else had it. And she was the one that was different, you know? And now her results are better because we taught her the protocols.
And I was just going to say, I'm assuming you have some resources for her and
training. Not only do we have obviously the marketing things, but what we do is we do online trainings, and my global director goes there, goes through the protocols, and then my university training program, I have them come and watch me do treatments with the skincare. So they understand how to use it pre, during, and post, so that it enhances the whole overall process. Because what skincare line does that? I mean, almost none of them tell you how to utilize the product. They say what it's for, but they don't show you physically when, where, how, and why, and every step of that process, and that's what we do that's a little bit different.
So awesome. So great. I love that.
Big investment, but I loved it. I love it. I love, so far, everybody that's carried it, we haven't had any single person say that they have a problem. In fact, they'll carry it and then they'll repurchase 3 times right afterwards because they're so happy with it.
Yeah, and it sounds like that's a side passion project that, you know, just fuels you. And it's a lot of work to build a skincare company, not only get the packaging and the formulations and all of that, I know, and the box development, but I did the same, and I love it because it was something that was creative. It was an outlet. It wasn't doing the hands-on injectables or surgeries or whatever. But it's crazy time-consuming. I mean, it's amazing.
Time-consuming and expensive. Now I actually have investors, so because we're expanding into Canada and the Middle East very soon. Wow. Our distribution in Canada starts actually this month, and then in the Middle East the beginning of next year. So it's a lot more of an investment to do. Plus right now we actually have starting, I think on Monday, a huge TikTok shop launch with over 1,000 UGC content creators.
Wow.
So it's going to be pretty amazing actually. I'm like a little nervous about it.
A little scared?
We'll see how it goes. Well, I mean, It's really interesting to have that many people at one time be using it. There's 300 that are going to be going the first 2 weeks and then beyond that. So it's a pretty crazy thing. We have a whole business for that.
Wow, that is awesome. But your enthusiasm is so palpable even through the screen. I wish I could give you a big hug right now.
I know. Obviously, we love to hug. Just so you guys know. No, it's just exciting because when people use it and they go, wow, I never, everyone tries to push products, but when I try something that I love that you created, like I have clients that'll buy 3 or 4 a month just to have it because they want to support me so much and they love it so much. They have it in every location that they go,
It's awesome.
And it just makes me really happy. But the development of the new ones, the new products was really the most fun.
So
like, the idea of this peel that I'm creating with a peel maintenance cream has been really fun. It's been very difficult actually. But now that we have the formulations that work and we're testing it and people love it, I'm like, this is going to be a game changer for people in the industry. So it just makes me happy because everything else that's been out there is pretty much the same.
Yeah. What do you do to turn your brain off? Because you so much remind me of myself. And you work out. It's like the,
Well, you know what is funny is my brain is not off when I'm on the treadmill. I actually built a gym, and my new treadmill is coming this week, so I'm hoping every night.
I'm gonna come there and work out. I'm gonna get a spa, three day a week spa.
How in shape, how good you will look if you come and hang out with me. Everyone
I'm
always
scared.
says, even my social media manager, he posted something the other day of 6 months working for me, and he works out with us, videotapes when he's there. He's on peptides now, and he stopped drinking. So he posted a 40-pound weight loss, and he's like, everyone that works for Dr. Emer always, if they follow his routine, become hotter and look better. Like everyone, because my lifestyle is very healthy. Like I barely ever drink. I mean, right now I'm doing a purified water cleanse. Like
I was like, oh, get me a Diet Coke, and I'm like, oh my God, he's gonna judge me.
I want to tell you something. For like many years, I still drink like 3 or 4 a day. I try not to, but you have to do mini cans. I love the mini cans.
I know. That's what I have.
No, I love being healthy. But even when I'm on the treadmill, I'm on Instagram and I'm like researching and stuff. But that's actually fun for me.
I was gonna say,
if I just stopped, it would actually be worse. Even on vacation, I'm watching podcasts and I listen more to a lot of the business entrepreneurs. I don't know, like Hormozi and Gary Vee and
Gary Vee.
Andy Elliott and like all of those people. Like I watch all of their stuff and I'm getting to know a lot of those people. I'm very into the wellness and health space right now. I do a lot of peptides and TRT for my patients. So I actually just got certified by, I forgot what the group is called, the American Anti-Aging Association. I read all the books and take these tests and stuff. Like 86 hours. I was like, oh my God, I'm going back to school. Like, this is crazy. But so I did all that because I really wanted to see, like, what is this society about? They're the big peptide anti-aging group. So, I've learned it all on my own, and I've actually just done my own research, my own study. We have like over 800 patients on peptides and weight loss and all this type of stuff. And it's exciting to see like how it's changed them, but also how it influences like lasers and healing and stuff. Like my post-liposuction patients heal so fast, they don't get fibrosis, their scars improve. Same thing with lasers. You do ablative lasers and you take like a GHK copper peptide and something like CJC for growth hormone and their skin looks perfect in like 5 days. It's like,
so is this IV or are these oral medications?
Sub-Q.
Oh,
so sub-Q. There's some pills. NAD you could do IV.
Yeah,
most of these are sub-Q injections. Like even full anti-aging ones, like epithalon, for example, is one that's supposed to fix your DNA telomerases and stuff for anti-aging and long-term vitality. There's like protocols people will do a week or 2 straight or every other day for a couple weeks, once a year to help them live longer. And like a lot of like certain celebrities do it. I mean, in the old days, people were going to like Cancun or Mexico to do IV stem cells and things like that for health. But now with these sort of peptide therapies, people are doing these a lot sort of here for anti-aging. There's just some restrictions kind of all over. But like I'm very interested in that, so I'm always like reading it, trying to get the most up to date, especially for women, because like I feel like for women, and you could tell me, because you don't look like this, you look like unbelievable, but there's a lot of women after they've had kids or 30 to 35, all of a sudden it just starts going downhill. Women age so much more rapidly after 35, I feel like, than men because of hormonal changes, stress, things like that. So I'm trying to I'm not really interested in doing female hormones per se. I have doctors that I refer to, but like just overall doing everything I can for their face, for their body, when it comes to the skin and overall health and just melasma and things like that over us to start to develop as women's hormones change or stress affects them.
I just think it's the unspoken word that when you're in your 30s, it's too early to do these things. And I think slowly we're getting the word to the masses, but people think, I'm going to wait till I'm 40, I'm going to invest in my family, I'm going to waste time, I'm not going to focus on myself. And then they realize it's much harder to turn back time than to prevent. So
exactly.
the word that
you need to do a clock stoppers. You need to be, it's like, you're not going back to the future, we need to clock stop. And that's why there's some people, like even after kids, let's say you had your kids young, and you had weight fluctuations, then you lose a bunch of weight, you may need a facelift in your 30s.
Yeah, and that's okay.
I had a girl the other day, 37, who came in with bad acne scars. She lost 40 pounds from Ozempic recently. She has 2 kids. And she said, and I said to her, and I went like this, and I was like, just lifting just to see if subcision would work. And it went from here all the way to here to her skin, like far. But all her scars, like 50% gone, just from the lift. Yeah. So I said to her, I go, I know you've seen 3 doctors before, but I bet you no one has ever said, if you did a facelift and did some fat grafting or filler with the laser, we could probably get 50, 70, 80% improvement in one treatment. Would you do that? And she's like, no one ever told me I could do that. She goes, I do this all the time, and I think my face looks better. I was like, yeah, because you have so much laxity. Not only did the acne affect all your volume in your face and damage the tissue, but then you also had weight loss. You have jowls. She had heavy nasolabial folds at 30, like 35. I was like,
and you think about those acne, the fibrosis and the scarring beneath that, and then the weight loss and the loss of volume. So it's almost like they're tethered down where the scarring is.
Cellulite. It's like cellulite.
It's exactly like cellulite. I was going to say that. Yeah, it's
exactly. I tell people, I'm like cellulite on the face, and that's what. So I said, I've had people write me bad reviews about that. Like I had a woman write, "Oh, I went to him and he said I needed a facelift. He was so direct." I was like, "But don't you want a doctor that like goes
just going to tell you,
and explains like if you actually needed that?" I mean, look, I look great, but look at this. I might need one too.
But everybody has that when they do that.
Come on, it's starting, the glands are getting bigger here. So
you know what I tell patients? If you keep pulling on it, then yes it's going to go down. So stop pulling on it.
I know, believe me. But what I mean, you know what I mean. But like sometimes I feel like earlier is better, and this is a case where somebody actually needed it. And I've had patients where they've lost a ton, like had gastric sleeve, and their whole face is. You can't do a FaceTite. I love these devices, but not all these devices are the treatment, or even threads. You know how many threads I do. But I'm very realistic about what people will get. Yeah. And the ones that come back to me and say they're unhappy, they didn't listen to me. Because I'm very thorough, very thorough. And this was a case where this girl was shocked a little bit at first, but then she was like, you know what? That makes sense. And I think she's doing her first laser in a couple weeks, but her idea was, let's do a facelift end of the year. And let's see what I can get. If I can make the laser do a little bit more, when she does this, it's going to be so much more, Like, it's not an age thing anymore. It's where are you in your progression of aging, And some things.
And what are your goals? And what are your goals?
Where do you want to be? At 33, had to have quad bleph. He had such puffy eye bags and stuff like that. And like, it's just how his genetics was. Like some people, they don't have that defined structure. They're round. They need a buccal fat pad, or they need their neck done earlier. And so it's all about just being honest with people when they present to you with a certain scenario,
Right. And I think starting biostimulators and natural, Easy Gel, PRF, all of those early in your 20s, just for skin health purposes, hyperdilute radius. I mean, this is going to keep you going into the years, and freezing time, as you said, not reversing it. But this has been so amazing. We're already like over an hour into this. We could talk for many, many more hours, and we totally should do another one. Thank you so much for being here. It's so good to see your face. I need to see your face in person. Maybe I'll come to New York when you're there next.
I would love for you to. You should.
Yeah,
I would love
that'd be awesome.
And listen, if you want to do another and talk about specific things, I'll do them whenever you want. And we can even have, I don't know if you're allowed to have 3 people on, but it would be cool to bring on other people too and have like a fun thing. But I'm willing to talk anytime you want.
Yeah, I think this was awesome. You're so fantastic. You're so multidimensional. There's so many things I'm sure we didn't even talk about, but love hearing your story. You guys all follow him. What is your Instagram exact handle again?
So
Dr. Emer Official?
For my office. No, Jason Emer Official for the personal, which has the shirts and the working out and my dogs and food. And then Emer.skin for the Emer skincare line.
Perfect. And check him out. He is fantastic. Thank you guys for listening. Like, subscribe, share, and we will see you guys again next time.